This video, entitled Understanding Appropriate Use Criteria for Calendar Year 2022, provides professionals who order diagnostic imaging with a high-level overview of Medicare's appropriate use criteria consultation requirement for advanced diagnostic imaging. This is Michael Mabry, Senior Director for Public Policy and Economic Analysis at RadNet. The appropriate use criteria consultation requirement was put into place by the Protecting Access to Medicare Act of 2014, or PAMA. It is currently scheduled to go into effect on January 1st, 2023. Until then, an educational and operations testing period continues through the end of this year. During this time, no claims will be denied for missing or inaccurate AUC information. Now, CMS is encouraging participation by ordering professionals and rendering providers. PAMA requires reporting of which clinical decision support mechanism was consulted, the appropriateness based on the AUC guidelines or the AUC adherence score, and the national provider ID of the ordering clinician. CMS has indicated that G codes will be used for reporting the mechanism that was consulted, and modifiers will indicate whether or not the order adhered to the guidelines, didn't adhere to the guidelines were not applicable, or if a consultation was eligible for an exception. So PAMA provides that advanced diagnostic imaging services are subject to the requirement. And advanced diagnostic imaging is defined as MRI, CT, nuclear medicine, or PET. So anytime you order one of those four modalities, an AUC consultation will be required. That means, conversely, that if you order non-advanced imaging, such as plain film or an ultrasound, an AUC consultation is not required. PAMA also sets forth certain applicable settings for which a consultation is required. First, physician offices and imaging centers, hospital outpatient departments, including the emergency department, ambulatory surgical centers, and independent diagnostic testing facilities. All those settings are subject to the AUC consultation requirement. Applicable payment systems include the Medicare physician fee schedule, the hospital outpatient prospective payment system, and then finally the ambulatory surgical center payment system. What is AUC? Or AUC are basically evidence-based guidelines that guide the ordering of appropriate imaging. So there are some exceptions to the AUC consultation requirement. First is if it's an inpatient, if the person is an inpatient and payable under Medicare Part A, AUC consultations are not required. In the event of a life-threatening condition, such as under EMTALA, AUC is not required. And then finally, there are some specific hardships, such as lack of internet access. In the event of an EHR system failure, a natural or man-made disaster, or some other extreme unforeseen event, and COVID-19. These are all hardship exceptions that can be used to bypass the AUC consultation requirement. In the final rule for the 2022 Medicare physician fee schedule, CMS came out with some additional exclusions. First, critical access hospitals are excluded from the program. Claims for both the technical and the professional that are not both provided in an applicable PAMA setting and an applicable PAMA payment system are also excluded. Maryland outpatient hospitals. Anytime an inpatient changes status from inpatient to outpatient. Medicare as a secondary payer. And if an advanced diagnostic imaging study was ordered before the AUC effective date but performed afterwards, AUC is not required. And for these later exclusions, CMS is going to come out with a new modifier to report those forthcoming. So some more definitions. So the furnishing professional is the radiologist, is the imaging center, is the radiology department. Ordering professional is the physician or non-physician clinician who orders advanced diagnostic imaging. A qualified clinical decision support mechanism is a CMS-approved electronic tool for using AUC. And then based on those guidelines, the mechanism will return a score based on how well that study adhered to the guidelines. G codes these codes are created by CMS. They fall under the temporary procedures and professional services category. Modifiers are found at, there are 2 digits found at the end of a code. And again, appropriateness is how well the combination of clinical indications, patient, and study adhere to the guidelines. Typically, the higher the score, the more appropriate exam. Conversely, a low score means that exam combination wasn't particularly appropriate. Oftentimes, you'll see that colors are used to categorize appropriateness. Red can be not appropriate, green's appropriate, yellow is somewhere in the middle. So on the example on the screen, we have appropriateness score for a 3-year-old female. In this case, the doctor wants to order a CT head or brain with contrast. But based on the clinical indications for this 3-year-old, that scored a 1 or in the red, being not very appropriate. Better or more appropriate studies for her include a CT head or brain without contrast, or maybe an MR brain without contrast, or maybe something in the middle would be like a CT angio of the head. Now, as I described previously, there's about 20 CMS-approved clinical decision support mechanisms, and each of them have their own G code. And you're going to report these G codes with your consultation. I also want to point out there's 3 free mechanisms out there. One is Care Select, the other one is AIM Specialty Health, and then there's RadWrite. Now, here's the current list of modifiers. And again, you'll report a modifier with your consultation. So the first modifier I want to talk about is the MA modifier. And you use the MA modifier to bypass AUC in the event of an emergency medical condition such as under EMTALA. The next 3 modifiers speak to the hardship exceptions. BMB modifier is for that insufficient internet access. MC modifier is reported when there's an EHR or a clinical decision support mechanism failure. The MD modifier is for that extreme, uncontrollable, or unforeseen circumstance, such as like a natural or man-made disaster. The next 3 modifiers speak to adherence. BME modifier is used to report the adherence to the guidelines. The MF modifier is used when it does not adhere. The MG modifier is used when there's not a AUC guidelines to consult. And this can sometimes happen based on the combination of the patient, the indications, and the procedure. There's just not a guideline to run the mechanism against. There's the MH modifier, which can be used to report currently when the furnishing professional does not get the required AUC consultation information. There's the QQ modifier that was created back in 2018 for the educational and operations testing period. And then, as I mentioned previously, CMS is going to come out with a new modifier for those instances where there's a specific exclusion as finalized in the 2022 Medicare Physician Fee Schedule final rule. So now that I've gone over the definitions, let's now perform an AUC consultation. So the first step is to access one of the CMS-approved clinical decision support mechanisms. Now, as I mentioned previously, Care Select, AIM Specialty Health, and RadWrite all have free mechanisms that you can use. Another option would be to see whether or not your EHR has an integrated CDS solution already built in. And then the fourth option is later this year, RadNet is coming out with a provider portal that you can order your exams. It'll accept and store AUC consultation information, and it has the Infinex mechanism already integrated. So the RadNet provider portal will provide you with that one-step shopping experience to do your AUC consultation requirements. So once you've selected your mechanism, you're going to have to provide some information. So step one is to enter required information. And typically that's going to be patient age, patient sex, the procedure or service being ordered, and then the clinical indications or reasons for the exam. And then based on that, the mechanism is going to return an appropriateness determination. It could be a score, it could be a simple here, not adhere, and oftentimes they'll provide you with a list of procedures that are alternative, that may be a better fit, more appropriate for the procedure in question. And then based on that information, you can either select procedure you originally ordered, or you can pick one of the alternatives. And one of the things about the Medicare AUC consultation requirement is there's no hard stop. So even if a procedure has been determined to be not adhere, you can still go ahead and order that procedure, and that procedure will be performed for the Medicare patient and go on to billing. So depending on the procedure you select, you'll then get confirmation information on that consultation. You'll then get an option to determine how you want that information delivered. You can print it, you can download it, you can email it. It depends on the mechanism. But ultimately, you want to send the G-code and modifier to RadNet with your order. So now let me kind of walk you through, give you kind of a sneak peek at the provider portal and the AUC workflow that we're working on. So kind of going left to right, the first step is under patient, you want to provide that patient information. Age, sex, other information. Under insurance, you're going to provide information about Medicare. And then moving to exam, the portal will provide you a kind of a step-by-step walkthrough method of determining the procedure you want to order. So in this case, we're going to order an MRI of the head and neck, of the cervical area, without contrast. Now, because in this example, the patient is Medicare, and we're ordering an advanced diagnostic imaging study, an MRI, there's the additional step of AUC consultation. And at this point, you can either do your AUC consultation now, maybe you've already done it through another mechanism, you just want to enter that G-code and modifier into the system. Or maybe there's a hardship exemption you want to claim. You can do that through the portal. And you can even skip this step and return to it later on. At this point, you also want to provide the diagnosis codes for the exam that you're ordering. In this example, we're going to do an AUC consultation for chest pain. So based on that information, in some instances, the AUC guidelines or the provider-led entity that created them, you might need to provide them with some more information in order for that determination to be made. So in this example, the AUC guidelines want to know about coronary artery disease. So you provide that information. So based on all that information, the portal will return an appropriateness score. In this case, an MRI of the spine was not determined to be appropriate for chest pain. And the mechanism provides you with some alternatives. One would be an ultrasound of the heart or maybe a stress test. So at this point, you can either stick with your MRI of the spine, or you can pick one of the alternatives. In this case, we're going to go ahead and just pick the MRI. And at that point, you're going to get this confirmation. And this is the documentation for this consultation that you want to either print or download into the patient's medical record, because you want to keep a copy of this consultation. Then from our perspective, from RadNet, we need the G code, which is Infinex, G1018, and the MF modifier, because in this instance, this consultation did not adhere to the guidelines. And you're going to send that information to us. And you can send that information to us one of four ways. You could write it down on one of our scripts and fax it to us. If your EHR has connectivity, interoperability with RadNet, you can electronically order that information or electronically send that information to us. As I described, coming later this year, our provider portal will handle that for you automatically. And then the last option is to call us with that information. There's some helpful AUC resources out there. CMS has a website for AUC. Many of the professional societies have come out with toolkits or other helpful information that you can use. For RadNet, we have our own webpage, www.radnet.com/AUC. There's this email where you can send us questions about AUC guidelines. And then there's also two documents out there. There's a what to know and an FAQ. So in conclusion, I want to wrap up with some key takeaways. First of all, the educational operation testing period continues through at least January 31st of this year. AUC is not scheduled to go into effect until January 1st of 2023. During this time, this educational and operation testing period, no claims will be denied for missing or inaccurate AUC information, but CMS is encouraging participation. Also, there's no hard stop. So even a procedure that's been determined to be not adhere or inappropriate can still proceed through the ordering process. Depending on the outcome of the consultation, the G-code and modifier are required for your AUC consultation. Doing the consultation is pretty easy. It's just a few clicks, it's fast, it's instantaneous. It's pretty easy to do. And ultimately, AUC offers the opportunity to improve patient care. It helps ensure that the patient gets the right test at the right time. And there's no loss of autonomy compared to traditional prior authorization methods. So with that, that concludes our webinar. Thank you for your time today.